It is one of those problems that can bleed into many other areas of your life. Millions of men and women suffer from thinning hair or hair loss. And we all know that when your self-confidence is low, your work, your social life, your relationships can all go downhill. But thankfully, the folks at Scoy Hair Clinics can help. We have President Dennis Scoy here with me on the couch today. Hi, Dennis.
Hi. Thank you. I'm glad to be here.
Yeah, absolutely. Good to have you. You know, we talk about hair loss, and I always hear male pattern baldness. That's like the one thing I think that everybody kind of has heard about before. But that's certainly not the only reason people have thinning hair.
Well, the majority of hair loss is inherited. About 40% of the men have a hair loss problem. 1/3 of the women have a hair loss problem. So it is male and female.
And that's a big issue. Obviously, we talked about self-confidence and that kind of stuff. It can really bleed into other areas of your life, can't it?
It sure does. I mean, I think people, when they feel good about themselves, they perform better at their jobs, they perform better at relationships. I mean, when you feel good, you look good.
And when you look good, you feel good, right? That's exactly it.
Right.
Okay, before and afters really tell the story, and I got to look at these before, obviously, today, but let's take a look at some of these and tell us how you helped them and the processes they went through. We'll start with this gentleman right here. I believe this was Sensigraft?
Yeah, Sensigraft is a dermal lens process. This is for more advanced stages of hair loss. It's a thin skin that's secured either to the person's scalp or to their existing hair. And so people that do this, they have this 24 hours a day up to 30 days at a time.
Okay, so that's how long that process takes, right?
Well, they actually can be in this, have this appearance 30 days, and then at that 30-day time they would go back and have a service, and it's redone for another 30 days.
Okay, gotcha. All right. Although we don't see it quite as often, we talked about women thinning hair a lot of times. I think sometimes maybe women try a lot of tricks to make it look like they have more hair than they do, maybe volume or whatnot. So this woman right here obviously needed a little more help.
She did, and this is a Relusions model where she needed more volume on top, and her hair is just not really nice looking hair.
Right.
And so it's a hair addition, a Relusion brand, and this is something that she can do herself. She can have the fullness that she wants.
And about that process, how long did that take? And this woman right here, same thing, right? Okay.
So, again, these can be, it takes 4 to 6 weeks to come up with the style, and then it's a styling process. I mean, we have licensed cosmetologists that perform these services.
Oh, great. So they come in and they can almost kind of look and say, this is the hair that I want, and choose it from there?
We ask them to bring in a style or some way that they want to look, and then what we try to do is duplicate it.
Is emulate that. That's really great. So as well as these, surgery might be what you automatically think you'll need to do if you have thinning hair, but these are non-surgical options, right?
Right.
So what are your options here as far as non-surgical and surgical?
Well, surgery is the person's own growing hair. So usually, I mean, when you think of surgery, the hair comes from the back portion of the head. We actually transfer that into the areas that are thinning. And as long as that hair the hair in the back of the head is permanent, so when we put it on top, it would be permanent there also.
Okay, so that's a more permanent thing. These non-surgical options that we've seen, you have to come and get maintenance, correct?
Yes.
Okay, so what is this gentleman?
This is also a multi-unit hair grafting process. Again, hair comes from the back of the head. We transfer it to the top by licensed doctors. I mean, the doctor that does our surgery, this is all he does, and he has been coming to our office since 2000.
Okay, what is the reaction you get from folks? Because just looking at this, I think these people don't even look like the same person.
Well, the idea is you don't want them to think it's some type of hair replacement. You want them to look at them, it's normal hair.
Okay.
And that's our job, is to make it look as normal as possible.
Now, is it ever too late for somebody to come in and get help? Is it ever past the point of no return?
I don't believe so. I mean, it depends on the individual. But I mean, we do people when they're young, and we have people that come in their 90s for the first time. And you think, well, when you're 90, it shouldn't matter, but it does matter.
It matters, all ages, all people, right? And you've made a big difference. Now, cost, some people, they might think this isn't going to be something that I can afford, but you have a really great deal for our daytime viewers as well.
Right. Anybody that would if seeing this program, we're offering a $500 savings certificate. So just call our office and we will set one aside for you.
Okay, perfect. Dennis, thank you so much. We've had your website as well as a phone number on our screen so people can get a hold of you, and hopefully you will help some folks out, get a little confidence boost.
Okay.